Hey guys, Dr. Carrie here. So you may have heard that our Pilates program is ending, but that's actually not true. It is just transforming. We're actually transforming it back to its roots. I'll explain what that means in a second. Basically, for those of you that don't know, I've been a PT for 23 years. About 15 years ago, I was feeling a little stagnant, having been a dancer my whole life. I always had this unique awareness of my body, especially when it comes to precise movements and being able to target very specific movements or muscles. And it was always really difficult for me to translate that over with my patients, because that's something that pretty much all of us need. Like when you have full body awareness, when you're able to control your movement and especially control your own pain, you can kind of do anything. And that's sort of what we do here. So when I discovered Pilates, especially using Pilates with the equipment, okay, I realized that was a very systematic and practical way to translate a lot of the concepts I had just naturally learned as a dancer to my patients. So that's where Pilates based rehab was kind of born, and that is actually how I originally started my practice when I was doing this all by myself a little over 10 years ago. We're celebrating 10 years next year, if you can believe it. Over the years, we started adding classes and things like that, but as our business has grown, we've realized that we also want to kind of get back to sort of what we specialize in and really narrow things into that specialized physical therapy piece. So what we're transforming to is getting back to that Pilates-based rehab. So what that means is using all the Pilates-based concepts, particularly the equipment, which the equipment on its own is pretty magical. And you're doing that with the physical therapy specialist, because when you combine those two together, you can get some pretty transformational results. The other thing we're transitioning to is we're really getting into the field of regenerative medicine. You guys have heard me talk about it a lot. If you haven't, I'm going to tell you again, but using regenerative therapies like shockwave and EMTT together has been absolutely game-changing. When you combine the healing powers of those two therapies along with the precise therapeutic movement of using Pilates, and then along with our corrective movements that allow you to take care of pain on your own at home, you can literally live your life being more active, healthy, and mobile without things like pills, procedures, and surgery, which is what we're trying to help everybody do. And we don't want to just help you stop there. We also want to help you thrive well into your golden years. You know, our motto is, hey, when you're 60, we want you to feel like you're 40. 60 is the new 40, okay? And by using all those things together, we can really help people do that. So Pilates isn't ending. It's just transforming a little bit, getting back to the roots, keeping it all a little bit more specialized, especially with the expertise of our therapists that we have here. And we're still going to continue doing our specialized programs, and hopefully we're going to add even more in 2026. So keep an eye out for those, but not ending, just transforming back to its roots. So hope you guys are having a great day. And if you are interested in learning more about Pilates-based rehab and what that kind of looks like for you, as opposed to maybe you were a class goer before and you were taking classes, what's the difference? You know, just let us know, reply to this email or give our office a call. We're happy to talk through it with you, let you know if you're a good fit. Maybe it's the missing piece. Maybe you're using Pilates classes to manage a chronic injury when instead you could actually get to the next level and get rid of that chronic injury. And sometimes working with a specialist and especially incorporating those Pilates-based things can be the difference. So hope you guys are having a great day. We're excited about the transition. Hopefully you are too. And let us know if you've got questions or you want to know more.